Okay, thank you so much for being with us this evening. I am Delegate Karen Greenhall. I represent the 85th District of Virginia Beach in the Virginia House of Delegates. And before I introduce our subject matter experts from the Department of Medical Assistance Services and the Department of Social Services, I'd like to give a big thank you to the co-sponsor of this event, Ron Taylor, who is president of the Hampton Roads Black Caucus. So they've been so faithful in helping us get the word out, and they're live streaming this on their website. And I would just like to personally thank Ron for everything that he does for our community. So thank you so much. So now I'd like to introduce the Director, Cheryl Roberts of the Department of Medical Assistance Services. She is a 16-year veteran of the department and was appointed to the directorship in November of last year. Director Roberts is regarded as one of the foremost experts in the state medical Medicaid service delivery. She and her colleagues traveled to Virginia Beach simply to do this information for us to make sure that the residents of Virginia Beach have this critical information and we are taken care of. So I thank them very much for their service with us this evening and their service for everything that they do for us day after day, serving the residents of Virginia. So with that, I'll introduce Director Roberts.
Do you want me here? Over here.
Well, your PowerPoint screen is here.
I am going to need help.
So it should be space bar to move between slides.
Okay, good.
Yeah, and then to go back, you can use the arrow. You can actually use the arrow forward key to, and that moves between the slides.
That's perfect.
Okay.
Hello, I'm Cheryl Roberts, and I'm the director for the Department of Medical Assistance Services that you know is Medicaid. And when you think about Medicaid, you should think about that we cover about 2.1 million people in the Commonwealth, and we expend about $21 billion. And so we play a big role. I usually think about it is that from the beginning to the end, we make sure that people are covered in this lifetime. No, I'm fine. But what I did want to do before I begin, I did want to introduce my team. We came down. Hampton Roads is important to us. So of the 2.1 million, 458,000 are Hampton Roads. And so you play a huge role to us in almost everything we do, from our delivery system into our populations. And so that's why we're here, and that's why we came in force. It's because you make that much of a difference to our whole program. I want to introduce you to a couple of people. First, our CMO, our Chief Medical Officer came, and her name is Dr. Lisa Price Stevens, and she actually lives in the Hampton Roads area, so she actually is contributing to it. Our legislative person who actually helped put the meeting together is Will Frank. He's here with us. We're going to talk to you about the operations of this whole process called the unwinding. The two people who work on that and are our strongest people in terms of the DMAS side is Janice Holmes, who is the assistant director, and her right hand, which is Danielle Noel. I always pronounce your name wrong. Sorry, dear. But DMAS and DSS work hand in hand, not only in the unwinding, but in eligibility. We are unique. We're one of 11 states in which the localities actually are part of this process. And so as a result of that, anything we do about eligibility and coverage and delivery system, we work together. And so we, of course, brought with us DSS people. Irma Blackwell from DSS, who I work with a lot, and Catherine Raymond. So thank you all for coming down. Before we get into unwinding, I have to at least tell you the big things that the governor would like you to hear in terms of messaging, okay? So what do we do? One, to know what do we cover. This is important. Please look at that number, because one of the things people forget is the number one group we cover are children. And most people don't think of it that way. So children play a role. We do 1/3 of the pregnancies in the state. We do older adults and disabled adults. The other adult population, which is the 804,000, are the Medicaid expansion as well as mobile adults. I call that my younger mobile adult group. And then we have limited benefits. This I'm going to go through fast. It basically tells you that when you think of DMAS, I want you to know that there are 3 parts to it. One, we're very member-centric. We care about our members deeply and passionately. Most of us, that is the driver. Some of us, because like me, who actually was a Medicaid kid at one point, but some of it is just because that is what our public health and servant spirit says. Then the second is that we're operationally driven. When you have that many people and that many things going on, if your operation isn't working, then it doesn't work. So we're a business in that sense. And then we're accountable. We have to be accountable for the money in the program. There's 3 priorities we have for 23. The one you came for is unwinding. I'm going to talk about it a little bit, and then I'm going to let everyone else do that at the end. But I want to talk about the other 2. Yes, as of March, Virginia is trying to redetermine all 2.1 million Medicaid members. It's a huge undertaking, but it's a national undertaking. It is not just Virginia alone. So when you look at it and you read about it, you have to understand that when the pandemic came, the federal government said that they wanted everyone covered, and therefore they said stop and do not do any redeterminations. Good answer. Hard answer, how to start the machine again. And so trying to start the machine to make sure that we do what we used to do, which is to do eligibility reviews, and we started again with DSS, and we started this spring. If you get no other message from me, I say this to everyone. It's really critical that we tell everyone to look for their mail, look at their texts, look at their emails, and if they get a package or they get that notification, please, please respond. We have many ways you can respond. You can respond online, you can respond by text, you can respond by telephone. There's lots of ways to go, but the thing we want people to do is to be, if you do nothing else, is to complete those renewal packets. I say this, and this is why it is. For those people who have young adults, I do. Young adults do not open envelopes. I don't know why. We don't teach them how. So they don't know how, because they refuse. And we have to figure out for that group, and we have a whole group of people in their 20s and 30s who we're seeing are not responding because they don't open the envelope, and they believe they're invincible. So what we're trying to do is that this is really important, that if you know people, particularly younger group, tell them open the envelope. And if they have struggles with it, tell them to call Cover Virginia, and they'll talk to you about that. Second thing is the governor's biggest #1 project is behavioral health. You're going to hear about it. The project is called Right Help Right Now. We can't ignore the fact that we have a behavioral health crisis. We have it in places. I'm going to talk about the 6 quickly. One is obviously crisis care, which is what we're working on. Obviously, the issues of law enforcement, getting capacity to go beyond hospitals, looking at substance abuse. That is the one that is really big, particularly fentanyl. Again, you can hear I have young adults because, as I said, in the old days, the drugs were hard and they were terrible. But here, you can send your youngster to a party and they don't come back. Okay, fentanyl is very subtle. Fentanyl is fast. And so that's something we're looking at, how to fix that, how to get the workforce, how to encourage people to go into the workforce. And the piece that I'm probably most responsible is developing the delivery system. If you ever want to know what our behavioral health system, we have dashboards. This is just one of them. I encourage you to go on the DMAS website. There's lots of information for you there. One of them is on behavioral health. There's maternity. There's other information. This is just a snapshot to kind of tell you the kind of information that's on our website in case you want it. And last but not least, most people know this. Most people don't know they're on Medicaid. Most people think they're in a health plan, and they should. We have 5 health plans. Aetna, Anthem, Molina, Optum, and United, and they all provide all of our long-term care services, our preventive, our acute, for 94% of the population. So most of the people, when they ask, are you in Medicaid, they say no. You have to ask them, are you in Aetna, Medicare? They say yes. So keep that in mind that the plans are actually providing the delivery system here. So what is happening here? We're getting ready to do an RFP. The RFP means that we're going to get more services and things that will actually help our members. We haven't done that in 7 years, and so this is a good time to do that. Any questions on those 3? So let's start talking about the unwinding. And Janice, I'm giving it to you.
Okay, good afternoon. Um, Certainly a pleasure to have this opportunity to speak with you all regarding our Medicaid expansion and not just expansion, but our unwinding of the Medicaid since the public health emergency came into being. And so I'm going to begin with talking about a little bit of background of this continuous coverage requirements and yeah, I'm on the right slide. I had to make sure. Back in 2020, states were required prior to 2020 to maintain the enrollment of Medicaid members and to receive an additional 6.2% increase in their federal match rate until the end of the month in which the PHE ended. And so since March of 2020, DMAS and DSS, our partners there, have collaborated on how we would unwind, how we would implement these flexibilities and protect the coverage of during the PHE to also allow for access to services. So in parallel, DMAS and DSS began planning back in 2020 for the eventual unwinding. It seems like we've been in the planning process even before the pandemic ended, but because we knew it was going to come to an end at some point, and we weren't certain how in the world we were going to unwind all of these flexibilities that had been put into place. So we continued to partnership with DSS throughout the PHE and to utilize all of our available resources to try to transition to normal operations. So the Secretary Lytle, convened a monthly unwinding task force beginning in January of 22. That task force included DMAS members and DSS leaders and the Office of the Attorney General. And in addition to that, it was expanded in July of 2022 to include Senate and House finance staff and the Department of Planning and Budget as per the General Assembly mandate that we were given. So in December of 22, the Consolidated Appropriations Act was signed into effect, decoupling the PHE from the continuous coverage requirement. And that was effective from March 31st of 2023. So this, the impact of it meant that the federal government would step down the enhanced matching rate that the department was receiving beginning April 1st and phasing out the enhanced match as of December 31st of 2023. So we're quickly approaching that deadline. So CMS also requires that states had to submit an approved mitigation plan, and all states had to submit this plan by March 31st of 2023. And so Virginia was one of 44 states required to submit the plan, and DMAS, of course, received their approval of the plan on March 29th, 2023. So the end of the continuous coverage requirements throughout the Commonwealth was a huge undertaking. It was one of the single largest health coverage events since open enrollment had occurred back when we had to implement the Affordable Care Act. And so with that, we went through various phases of the planning process. Historically, prior to the public health emergency, the Commonwealth had and Medicaid program always experienced churn of its members coming on and off of the program. But as of March 20th and through March 1st of 2023, the Commonwealth experienced an increase of over 630,000 enrollees because none were coming off. There were only folks coming on to the program, which was a 41% growth in enrollment growth. So that enrollment growth, of course, was fastest amongst our non-elderly and non-disabled adults. And it was even slower among our children and our age blind and disabled. So primarily it was our expansion group. We had at that time had just expanded Medicaid to include individuals between the ages of 19 and 64. And so they came on. There were many tremendous efforts to get folks enrolled prior to the pandemic, and it worked. So now, post continuous coverage, we expect roughly 14% of the state's total Medicaid enrollees may lose their coverage. This is what we expect. There have been folks who have been on, as we said, they didn't churn off. Some have gotten new jobs. Some have moved, found some that have moved out of state even. But we know that we might see roughly 14% who will lose their coverage, and up to 4% of those members may lose and come back, regain their coverage within 1 to 6 months. So and this is in line with the national average, of course, for loss, which is around 20% as well. So we've got our projections out there, and we're working to ensure that those who are eligible remain on, and those, of course, who have received new jobs, moved, or done whatever, they no longer need these services at that time. So it's a striking the right balance of keeping the right folks on. Okay. I'm going to turn it over to
I can continue. It's okay. It's okay. Yes, it is hard to get in and out of there. Okay, so in preparation for unwinding, there was a very strong emphasis on system enhancements to include increased automation, trying to get a determination pushed through without a manual touch, workforce tools, reporting, and expanding existing operations. Again, all to ensure a timely completion of the unwinding. To give a little bit of a background, Cover Virginia. I don't know if everybody's familiar with Cover Virginia, but Cover Virginia traditionally exists to help individuals get enrolled into Medicaid. We take new applications. Prior to the unwinding, the call center would submit the renewal applications. They continue to submit changes for the Medicaid members. Do things like submit ID cards to members, mail them out, and just provide a plethora of services to our Medicaid members. For this process, for unwinding and preparation, we've partnered with Cover Virginia, with our vendor, and we've executed successfully a contract modification to assist with this work. So in addition to the call center taking in the new applications and submitting the renewal applications, their central processing unit is actually assisting with processing the renewals. And so that's going to alleviate that burden for approximately 420,000 cases, or a third of the cases that need to be redetermined during this unwinding period from the local agencies, in an effort to ensure that we stay timely for all of this processing. In addition to having Cover Virginia assist with the processing of these renewals, they've also implemented new call centers to assist with our assisters who assist the applicants and also assisting with getting the renewals completed, as well as they've implemented a new pregnant women unit within the call center. Again, all to try to streamline the services and get individuals the timely responses that they need. Outreach and education. We've done a lot of work to ensure that we get the word out. In addition to these town halls like we're at right now, we have sent mailings, and we have ongoing mailings being sent to 1.1 million households. We've had radio, television, and social media campaigns, and we've got dedicated pages to this unwinding project across 3 websites. We've got on the coverva.org website, we've got materials out there that are available to the public, which include toolkits. It includes all of our outreach templates, provider memos, as well as information on the town halls that have been held and are being held. In addition to all of that, we also had a Return to Normal Operations Summit, which was held on March the 8th with over 300 of our stakeholders in partnership with the Department of Social Services, the Virginia Association of Health Plans, the Virginia Poverty Law Center, the Virginia Healthcare Foundation, and the State Corporation Commission, which was a huge success. It was really great to get in a room with everybody and to get this in front of them, and I think that went really well. So. Any questions on any of, yes, ma'am?
I was reading up here while you were talking, and I noticed that you didn't mention, there's a statement there that says the operation includes an existing incarcerated unit.
Yes.
So can you expand on that?
Yes, ma'am. So Cover Virginia Operations, they've got the call center that I mentioned, and then they have their central processing unit, which traditionally processed the new applications, and now they're also processing the renewal determinations for those non-aged blind and disabled individuals. And then they also have the Cover Virginia Incarcerated Unit, where they have a call center for the facilities to reach out to in order to do a lot of the same services that the regular Cover Virginia call center handles, but for that incarcerated population. And then they also have their own dedicated eligibility unit who handles the eligibility processing for those incarcerated. They handle the new applications, the renewals, the changes. They are maintaining those cases within Cover Virginia Incarcerated Unit.
A follow-up on that. Do the people who are incarcerated have to reach out, or is information coming to them?
So the individuals, they're the facility representatives. They have counselors who typically are assisting with that. So they're contacting us with the inmate, and they're giving us the information needed to determine eligibility for them.
So it's up to the facility personnel themselves.
We collaborate with all of the incarcerated facilities throughout the state. So DOC, Department of Corrections, Department of Juvenile Justice, and the local and regional jails. And we collaborate with their staff to ensure that we have a process which meets their needs. You know, they've got resource limitations, but they will, if they identify an incarcerated individual that they believe meets the criteria to apply, most do, they will get them to a phone and they will call Cover Virginia, the incarcerated unit, and can apply online. So they ensure that any inmate that definitely meets the criteria would be able to apply.
Oh, I was going to add one more thing, sorry. For the unwinding, for the renewal, because we have individuals incarcerated who are up for renewal, we are closely monitoring that and communicating those who are up for renewal to the facilities, ensuring that we get those renewed as well.
For those who have disabilities, both young and adults as well, for instance, autism or whatever it might be, or maybe just physical ailments. So how are they going to approach the renewal with people that have disabilities?
Well, we have separate processes for those that are age blind and disabled. Do you mean from like a call center perspective, or what's submitted?
Well, when you're renewing and people are getting all of these renewals in the mail, my concern is, will there be boxes for, to explain people's disabilities or what have you, and how is that going to happen properly?
Okay, so when you get the renewal packet in the mail, there are spaces in there for you to mark if you're disabled, and then it does have questions dedicated specifically to being aged, blind, or disabled. You can also go online to process the renewal, submit the renewal, or you can call Cover Virginia, and they are trained to be able to assist through that renewal application for that population. Yes, it is.
Let me help a little. Okay. Going backwards a little bit. The way the system is working is, one, the first thing we do every month is that we go through a series about a couple of 100,000 that go through automatically. So that's what we call ex parte. You don't need to memorize it, but ex parte to us means automatic. We don't touch it. Then there's two sets of groups of people. You're correct. One group of people are going to get a packet, And that group of packet group of people are usually, just like we talked about, are mobile adults, that group. The people who are age blind and disabled usually have to go to social service, okay? Because of the way, like you say, there's more complications. And social service has different ways they can go through. Cover Virginia helps you navigate through it, but yes, you're correct that you will probably have to get some additional information. But before we forget, I do want to write Cover Virginia's number down because we're not saying it enough. 833-5-CALL-VA. 833-5-CALL-VA. Keep that, I always tell people, keep it in your phone because you're going to need it, okay? And so that's why DSS is here, and they're going to talk about that process and what happens in their offices. But I just want to say, so the way it works is we do an ex parte run. That's automatic. So that way you usually get a yes, you're happy. But 90% of the says yeses, and it's go fine. Then it goes to 2 different groups. Those people are like, if you get a packet, you have to take an action. Okay, that's how you do it. And for that group that has to take an action, we also have other people also, not just you get the packet, you can get a text, a phone call, there's some other follow-up to also make sure that you're actually acting on that packet. If you are age blind and disabled, let me go back to it, both at getting personal care or nursing homes, we're making sure there's outbound calls being made to you in addition to that, saying, let's go, let's make it work, because we don't want any disruptions. For people who have high issues, chemotherapy, things like that, the plans are also calling. So we are trying to target not only the age blind disabled, but people who actually have chronic illnesses that we don't want to disrupt. So that's how you can look at the triangle of ex parte, Cover Virginia, 833-5-CALL-VIRGINIA, okay? And then the social services and the localities, where people need to go in, whether it's because of bilingual or the issues they go in and have a face-to-face, or they can actually do that online. Okay.
I do want to add one thing. One key word we didn't say. They get a pre-printed renewal. So a lot of the boxes are checked, but in 3 years, a lot has changed.
Renewal every month. He has autism. I mean, every year he gets a renewal. So that's why my question is concerning. Concerning with that.
Just what you said, in 3 years, a lot can change. Is there any way or outreach if a person, and so many people, businesses closed, they lost their jobs, they could be homeless by now. How do you manage that?
But finding them, or
Yes, finding them or getting the information out to the shelters.
well, let's start first answer. Before we started this unwinding process, we went through a big address cleanup. We used our health plans for that, and actually said, because the health plans actually have the claims, right? So they actually knew the people where they are. They even know if you're in a homeless shelter. If we know it, then we had that information. And that's why the answer isn't that if your address and your mail comes back, we don't make an automatic assumption. We actually try to find you if we can, particularly. Try, okay? But at this point in time, we do need the person to be engaged. Okay, this is an engaged somehow. But if they have seen a doctor or have been engaged, we usually have that information from the health plan.
Any other questions before we move on? Yes, sir.
Yes, I have a question concerning Medicaid and as far as different programs that's being rendered, like mental health skill building, intensive in-home. What about those clients that have to be reviewed for eligibility? Who's responsible for ensuring that they are back in the system and recertified?
Are you talking about the provider or are you talking about the member?
Is it the provider or the member responsibility to ensure that the member is the client is being served?
We went, at least we tried. One of the things we did as part of our outreach is we talked to every major association and every major group, including the community mental health group. And what we asked them to do is, we know if your client has a severe mental illness or needs help, they're going to need assistance. So we did this type of training for each group, including giving them toolkits. So the providers should be in a position that if they have a client, to help them guide through, at least to get them to either call a Virginia or a local social service if they are coming up for renewal. In terms of the providers, we are depending on particularly our CSVs and the community providers to help us through this process. But we did, I know it's a fact because I was there, as we did the associations. We did 2 of those for the association. For the provider associations. Okay, and Mindy had that group, and we did two of them to basically give toolkits. We have toolkits available online so that all the providers can download that, and that will help them navigate any of the FAQs. But if any provider particularly wants individual attention, tell them to send us an email, and we'll happily talk to them. We'll talk it through.
Next one, we can move on. We can move on to the next slide. Okay. Okay.
All right.
So what we've done in conjunction with this whole process of nobody being renewed for 3 years, and we've just been sort of in a state of everybody is enrolled just to stay enrolled because of the pandemic. We've made some changes in the background for different programs. We have developed an e-learning system that helped refresh local agencies on how to process renewals. It's been 3 years. You have a lot of turnover in local agencies. And so you have staff that maybe has never processed a Medicaid renewal. You have the intake staff that will take them for the ones that fall through at Cover Virginia that drop down to the local agency, which are generally your age, blind, disabled, and your long-term services and support individuals. But you have staff that have never actually done a renewal. And so they developed an e-learning that helped staff familiarize themselves with the whole process. And we had over 3,000 local agency staff complete this training, which is pretty significant. In addition to that, we've been hosting subject matter expert-led webinars for quite a while, it seems like, that focus on different Q&As with the local agencies and to assist in preparing them for the work. What are they encountering now? If they haven't touched Medicaid cases in 3 years, what are they finding? There have been some system changes in the background with policy changes, but what are they encountering? And so we have these weekly Q&As, which are moving to bi-weekly, I think, shortly, to help prepare them for that work. But we've had over 2,000 local agency staff that have attended these webinars and this series, and we're going, it says continue until the end of April 2023, but we're still holding these. We had the series that backed up the e-learning, but we've also been holding now weekly and going to bi-weekly sessions to help staff with different things that are arising that they aren't familiar with, different scenarios. But we hold those panels with staff from DMAS and the local consultants. And I think we're trying to work things through. Things are moving along at this point, I think. And so when we come up with a problem, we're trying to address it for the local agencies. We have 120 local agencies across the state with DSS. And we are trying to make ourselves available for them during this. So anything that they're encountering, they can bring to that session. We also have 5 regional consultants that are available, and we have home office staff at DSS that are available for those questions as well.
So in addition to all of that, we also coordinate with our managed care organizations and the Virginia Insurance Marketplace. And with that, we executed an agreement with our 6 health plans to solidify the plans to do 4 rounds of targeted member outreach across all modalities. We were significantly involved with that planning process, how they would outreach, what the message would be so that there would be a continuity of the messages from all the plans, and in addition to what DMAS and DSS were the messages that we were all putting out, so that there was continuity in what was being stated. We implemented new data sharing processes that included correct addresses and closures and closure reasons, so that we could track all of the processes and all of the changes that we're going through in individual cases. In addition to that, we collaborate with the State Corporation Commission, who is bringing up our new state-based health insurance program. And so it's called the Virginia Insurance Marketplace, and that will be up in November of 2023. That's a collaboration that's continuing. We meet with them regularly to ensure that there's a good transition of cases between the locals and DMAS and the Virginia Insurance Marketplace. And lastly, Virginia was one of the first states to bring together the commercial and Medicaid side of the health plans to transition individuals no longer eligible for Medicaid to other health plans. So we've done all of this to help streamline and to communicate effectively with our members. Let's see. Our community outreach and engagement has been in phases. We've mentioned the initial phase 1, where we sent letters and whatnot to the members to get updated addresses, ensuring that they have communicated to us, called Cover Virginia to update their addresses, and including the managed care organizations. We're doing the same thing. Encouraging their members to call us to get their address updated, and we made sure that any changes that were received were updated prior to the renewal process beginning. And this is ongoing. We continue to encourage folks to ensure that they have an updated address in our system so that they get their renewal packets. We still have a big issue with return mail, and so we continue to try to solve that problem as well. The second phase is, once again, to encourage members to return their paperwork. As Cheryl mentioned, people don't like to open their envelopes. Everyone's in a digital age, and they don't like mail. And so they're not paying attention to these paper envelopes that are coming. But that is the messaging that is going out. We started in March of 2023. And we've involved all of our stakeholders to continue to let people know that you need to open your mail. You've got to respond to this. Lastly, phase 3 is to encourage members who lose coverage for an administrative reason. They failed to act. They failed to respond. They didn't send back. They need to call us. You can still, it's never too late to call us. And let us know. If you didn't send it in timely, there's a 90-day grace period. Send it in. It doesn't matter. And even if you miss the 90-day grace period, send it in. Your coverage can be reevaluated. That campaign started in April of 2023 and continues. And we primarily, the health plans have their participation, and of course our marketplace navigators assist with that as well. Any questions there?
When will, because I have not received anything in the mail, so when are things expected to coming in the mail?
As we stated, we have quite a few renewals to do, including those that are in the past, cases that haven't been renewed, of course, in 3 years.
We divided it up by 12. So you have over 12 months. So therefore, it may not be your time.
Right.
Right. Okay.
Right.
You can call Cover Virginia
And they can
and
tell
ask
you.
when your renewal time is, and they'll be able to tell you.
Call Cover Virginia once again.
833-5 Virginia.
So they won't just automatically renew it like they do each year for anyone?
There are some that will be automated. The ex parte process. Everyone will go through it. Some will fall out and receive a paper renewal.
Thank you.
I have a question from the live stream from Katrina, and I don't know, I'll just ask it now and however you want to do it. It says, why are some new agencies being delayed for services? Because skill building isn't a top priority, but very much needed for mental health clients. Does that make sense?
That's not an unwinding issue. That sounds like a licensing issue, and that's another agency. Okay, but if you give us that person's name and information, I'll get an answer for them.
Okay, great. Thank you.
I got a question there. But if license them, right?
Another agency.
Yeah, that's the development of services. But the MCO works for DMAS with the contract.
Yes.
If they refuse to credential the new agency, the new license company, that I think that's what that individual was talking.
I would like to get the question because I don't want to speculate. But yes, what happens is that all providers in Virginia who want to participate in Medicaid and want to participate in a plan have to contract with one of the plans. And so that's a process in itself. But I want to finish. Can I finish the unwinding and then we can answer your questions? I don't mind it, but I just don't want to lose the unwinding question. Okay, that's why. It's fair. And get it to us, and I'll happily make sure that both the person in Dibbets and at DMAS can handle it.
Absolutely, and the person is watching us, so they're hearing us.
So then you can hear that I have committed that I will get it to you.
So thank you so much.
Okay.
We have a number of options available to assist with any sort of language and disability access issues. All of the unwinding online toolkits are available on the DMAS website and through coverva.org, and they're available in numerous languages to include English, Spanish, Arabic, Amharic, Urdu, Vietnamese, Dari, and Pashto. They have accessibility to screen readers, and that includes notices informing individuals of the availability of free language assistance services and auxiliary aids and services and how to request those services. The return to normal enrollment town halls and listening sessions, which is what we're doing now. We've got the communication access real-time translation, which is basically just captioning services available. And again, it includes those same notices as what was referenced on the unwinding online toolkits. Let's see, we can move on. The call centers are also equipped with interpreting services. So Cover Virginia Call Center has Spanish-speaking staff available, bilingual staff to be able to assist the Spanish-speaking population. And in addition to that, we've got interpreter services as well that are utilized for all the languages that would be needed. For fee-for-service individuals, we do have the renewal reminders messaging, which is sent through text messages, emails, and also the robocalls. So individuals will be contacted that way, and those messages are available in non-English languages. We've also been working diligently to update all of our eligibility notices, and so the eligibility notices can be translated into the top 5 languages spoken by Medicaid recipients, which does account for 99.2% of our members. And this is based off of what is chosen when they apply as to what their spoken language is. They're available in Spanish, Arabic, Amharic, Urdu, and Vietnamese. Every notice does include a notice supplement with language taglines accounting for the top 17 languages spoken in the Commonwealth. Any questions on any of that? All right.
Give us a little data.
We like data. So this is just some of the data that we've compiled during the unwinding. We have had, so far, a total of 487,829 members have been redetermined by June 30th, which is pretty significant. 391,025 members were renewed with ongoing coverage, and 96,804 individuals had coverage closed through May 31st. And there's a public-facing dashboard which is going to be updated to reflect these closures occurring on July 31st. That'll be updated on August 8th. So we're not quite there yet. But, I think that's a pretty significant number to have 487,829 members determined through June 30th. That's just kind of amazing. And you see up at the top how many we need for a redetermination is 1,678,552. Remember, we haven't closed anybody in 3 years. And so everybody that maybe would have fallen off through attrition or as was mentioned, they've moved out of state or they all of a sudden have a job that they're no longer eligible. They've just been, rolling along during the pandemic. And so we have all these cases that we're dedicated to making sure are reviewed within the next year. And so that's very significant. For our top closure reasons, and these are closures through June 30th, since we're still in July, June is marking the 4th month of our unwinding. The first month that renewals were due in Virginia was May, which we start that process a little bit early to get ready. The renewals or redeterminations that were received in April were processed. However, April did not include closures for failure to return their Medicaid renewal packets. So we didn't start closing people until May. As of June 30th of this year, 61,450 members were closed for non-procedural reasons, which means that they were not eligible any longer, and 35,354 members were closed for procedural reasons, such as they didn't return a renewal form or the required verifications. We have a process where we ask you for certain information. A lot we can determine electronically, some of it we cannot. We even have a system where with resources, there's a system that we utilize called the Asset Verification System. Currently, it's just for your age, blind, and disabled population. But in the fall, I think we're going to include the families and children population. But we can electronically inquire any resources that you might have, which removes the requirement for people to submit a bank statement. If we can pull it out electronically, then that takes that burden off of them. And so that helps to some degree, but they're going to open it up to the families and children population later this year. And that's for people that, for families and children, that population does not have a resource requirement unless they're on what's called a medically needy spend down. And I won't go into that because that's more than you ever wanted to know.
Have your attention, please. The library will close in 30 minutes at 7 p.m. Computers will shut down automatically at 10 minutes until closing time. Please save your work. Again, the library will close at 7 p.m.
We're good. We have the room till 7. I had a question that was put in online that might kind of tie into that. This person says, I know someone who wants to find out if it's possible to hold off responding in case they end up being ineligible. If they're one of the people who end up losing their coverage, can they keep it longer by waiting to send back their paperwork? They have a scheduled surgery in the fall and want to make sure they still have coverage by then.
Unfortunately, that's not a good idea. Yeah. Yeah. We have, as Janet and my cohorts mentioned, there are scheduled renewals. We're taking a part of the renewals from the past 3 years, and they have a schedule that actually you can view on the Cover VA website that'll tell you when your renewal might come due, or you can call Cover VA and find out when your review is due. If your review does not process what they call ex parte, which is no touch, then you get sent a renewal packet. And if your renewal packet is not returned to the local agency, then you do get closed by the deadline, which is the 16th of every month. That would not work. What happens, there are mitigating circumstances. If they get closed and they feel that it was not fair, they have the ability to appeal it. We don't, if someone feels for whatever reason that they were closed in error, they have the ability to appeal, which may be upheld or found that it was correct.
If she thinks that she has what we call excess income, we are hoping that people got jobs and did well. I mean, that is the ideal, right, over the 3 years. And if she believes she needs insurance, she should call the exchange. And there are low-cost and no-cost options there so that she can still get insurance. So it's not Medicaid only. Okay. So if the answer, but she can do Call Cover Virginia, and they'll help walk her through it. Absolutely. Okay. And even if she's in a plan, most of the plans have an exchange partnership. And that was what Janice was saying, so that you can get walked through it, so that you don't have to be dropped. You can actually go right through, and the plans decided that they would do a transition there. So tell her not to worry yet, okay? That one, call her to find out when she gets renewed. But two, we can help walk her through to make sure she gets insurance so she can still have her surgery, okay?
And I want No, I just wanted to add, don't rule yourself out. Let us determine. There's some income that's not countable. Let us determine your eligibility, and then we can also give what other options you have.
For
You know
clarity,
that.
when is the last, when will all the unwinding packets go out? When will everybody be processed by? April 2024 or before that?
It is April
So
2024.
by April 2024, you've either heard or something's happening,
Right.
You
and
either get a happy letter saying you're continued, or you tell us goodbye because you got your happy job with insurance.
That's right.
All right, there are options, and so, but we do want you to know, we did talk to the exchange to do that transition. So we want people to be able to stay covered.
So I have one more that just came in. I'm sorry, I'm not trying to blow it up, but how long would it take for someone to be reviewed and eligible? I guess that means maybe kind of what she was saying, but once their paperwork gets into you, what is how long?
It can take up to 30 days.
That's
Yes.
not really bad, actually. Yeah. Okay.
I have a
Thank
question. My granddaughter we did her renewal or over the phone in March when she was supposed to. On June 1st, she received her new Medicaid cards for the cargo thing. On June 30th, they closed the case. And she got nothing up until 2 days before that, saying that the case was being closed. And we don't even know why, it doesn't say on there. Because she did do the renewal.
Okay.
She has 2 children.
Okay.
And once more.
I will get your contact information and I will look into it first thing in the morning.
All right, thank you.
And I think because we are limited on time, if you guys want to finish the slides, and if we have any time left, we can take any more questions. I won't interrupt anymore with these questions from online.
And the only thing I want to bring up here is to tell you what Hampton Roads look like right now. Okay, so we do have that. There were 94,000 people who've been reviewed at this point. 78,000 continued with coverage. 15,000 have been lost coverage. So that's where we are. We're about 16% in the region. Remember, Janice said we'd be at 14%, so we're in line. So I just wanted to give you a sense of where you are regionally.
Just kind of as a curious note as to the top closures by eligibility grouping, and this is through June 30th. The highest closures, as we suspected, happened among the non-age blind and disabled adults, which would be what we call the low-income families and children, or the expansion adults, which came into play in 2019, followed by children, and then those in limited coverage, which are what we call Medicare savings plans, where it helps pay their Medicare premium, Plan First, which is family planning, incarcerated coverage, or emergency Medicaid. The non-procedural closures outweigh the procedural closures in every category. And so there you have a pie chart that breaks it down, with the largest part being the non-age blind and disabled adults. And so those are the ones we were talking about earlier. That's that population that, oh, they get the mail and toss it to the side. And they don't realize until they go to the doctor several months later, oh, I've got no coverage. And that's very awkward to show up at a doctor and find out you don't have coverage. You know, especially, or go to get a prescription. And I'm guilty when I was listening to this. I don't pay attention to my mail. I'm 55. I need to be better. But, you know, we have to, you know, instill in people, make sure you're looking at your mail, especially during this next year if you have Medicaid coverage. You might get a review form. You might get a notice of action like this young lady did. Did you get a notice? No, okay. Yeah, we all need to talk. But just make sure you're keeping an eye on the mail. Yeah. And things can happen. And you can also go online and try to log into your account. It wouldn't let you? We're gonna take care of you. And we're going to find out. It's frustrating because we don't want people to be in your situation where you're all of a sudden you have no coverage. You show up at the doctor and they want to turn you away. You can't get them, and you need to take care of your child. So just some additional for what we call the unwinding. It gives you some information. The ones that we don't have to touch, which we call ex parte, and they're automated. The customer doesn't have to do anything. It's all done through the system where it backs up against information held in the federal hub touching income, and et cetera. Just to give you, you can see there that there's a baseline of cases. This starting in, let's look at June. June, there were 119,444 cases that were picked up through the automated process, which included a total of 218,310 members, which is pretty significant. Of those being successful, unfortunately, of that 119,000, only about 32,000 were successful. And so that is an average of 27.3%. But when someone gets closed, what comes with that, you also have the capability to appeal. An appeal is a chance for you to have your side of the story heard. Generally, an agency will do a local conference with you before, so they can say, here's what happened. We sent out a review. It wasn't returned. You got closed, or to explain to you what happened. But you can take it past that to the actual official appeal process, where they'll have an appeals officer from the Department of Medical Assistance Services. You'll get an appeal summary. You'll get all the information of what occurred to the point where you got closed. And that's not just for ongoing cases. That's if you happen to apply as well. As of May, they only had, you can see there's been a tick up in the number of appeals from just April to May, 621 appeals. They were able to close 441. There's still 678 appeals open. So you always have the right to appeal a decision on your case. And then we have to comply with requests for information. FOA is Freedom of Information Act information. Then you have your constituent in the legislatures. And so it gives you the baseline, and then through what we call the unwinding, which sounds pretty scary, but that takes you through May, where we've only had one request for an unwinding Freedom of Information Act, but total of 19, 77 constituent inquiries that were not unwinding related, and 20 from a legislator. So just some additional data to give you a picture of what's going on. Next slide, please. And there's some pretty important information and resources that are available to you as either a member or stakeholder or just a community member or concerned family member. Those are found. It's a very good website, the Cover Virginia website. The DMAS website is a wealth of information as well. And on the DMAS website, as well as Cover Virginia, there's a return to normal enrollment page on each site that has toolkits. It'll tell you, if you knew when your review used to be due, you can look, there's a calendar there that tell you when it's going to be during this 12-month unwinding process. The Cubre, Virginia, I'm not quite as familiar with. That's what I was thinking of. I was like, I know Spanish. I speak Spanish. But there's information out there to help you online. I mean, especially the younger generation, you find everything pretty much online, mostly on your phone. But there's some interesting, statistical data there as well. The renewal status dashboard, that's found on the DMAS site. There's a data tab that tracks the progress towards redetermining Virginia's Medicaid population on a monthly basis. And it's kind of interesting, I go out and look at it just to see what's happening. There's a dashboard there that you can see what's going on within the state. And there are also legislator resources and information that are found on the DMAS website, and that gives you the address there. And new dashboards are available, which provide the enrollment data by Virginia's State House and Senate District, as well as congressional districts. So it's kind of interesting to see where things lay. And this brings us to the end, and this lists all of our partners that we have. A lot of them are our managed care providers that are out there, as well as I saw Virginia Poverty Law Center, Enroll Virginia, and of course we have DMAS, Virginia Healthcare Foundation, and SCC, which is quite involved. And from that, I will pass it back over to my colleagues.
We're going to listen to any questions, but I hope, otherwise than memorizing the Cover Virginia number, which I will repeat for the last time, I hope. What I hope you heard was, and I will answer any questions, is that we care a great deal about how this is working. And so we'll be open for questions of anything you want of the department. Some we'll have to get back to you, some we can answer here, but we want to be open to any questions about particularly coverage. You had a question?
The question is, you have spoken the number 8335 call Virginia, but on this gives a different number.
And the
Covered.
855-24285.
That's direct.
That goes direct. The number that she gave also will route there, but it also gives you options for other Medicaid call centers in addition to Cover Virginia.
Right.
So like if you have issues, you received a bill in the mail and you need to contact the member helpline, there's an option there as well. So that it still gets you to the same place, it just gives you more options with the number that Cheryl
Could you give that
Dr.
again?
Roberts gave you. It's what was that?
We should-
833-5 call Virginia. VA.
8335 call VA.
I have another online. We're going to do a couple questions, and then Delegate Greenhall wanted to kind of wrap it up. We just do need to be out of them just by 7, so we have time. So the question, another hard one, I think. If someone has started living out of their car since enrolling and uses someone else's address, and they don't get access to their mail often, is that sort of limitation taken into account if they're late submitting?
If they're late, they really need to contact. Yes, they need to contact us and let us know what's happening. They can also coordinate with their local agency to assist with that. Did you want to add anything to that?
But once they do get in contact with us, they can go through the process and we'll reinstate them.
Yes.
And I was going to add, if like my colleagues mentioned, you can contact Cover VA through the call center. They can tell you when that review is due. And if they happen to do their review early, we're going to process it. So if we receive it, we will process it if it goes through the call center or if it comes to a local agency, the ones that fall out of the progress. We will complete it early.
We
got a couple.
Is it my understanding that after you receive the paperwork, assuming you receive it, you have 30 days?
May I have your attention, please? The library will be closing in 15 minutes.
Word,
Please
okay.
check out your materials, save work on computers, and begin to turn in study room keys now. Again, the library will close at 7 p.m.
We have time.
30, do you have a specific amount of time to respond? It's 30 days or what?
The packet that's received will have a deadline on there.
Oh,
It'll be listed on there. Now, as Janice mentioned earlier, there is a grace period. So even after that point, after the coverage closes, you have up to 90 days to complete that renewal and be reinstated based on the renewal. Now, after the 90 days, if you haven't renewed, we can take a new application.
So if anybody in community comes to us and is asking, I'm nervous, I don't know what the status of mine is, the Call Virginia line will tell them what due date they're going to be looking at, right? And we'll be able to be given to them.
A CSR will be able to assist with giving
By
them when
phone.
their renewal, yes.
So this is just kind of a quick two-part question. There's been a lot of confusion, like with people, when the phones are answered. Is there a specific website where the specifics are listed of who qualifies? For example, you have a student in college, the student's on a food plan, the student's living alone, not on a food plan. There's a lot of different answers that are being received as far as how that all looks. And then my other question is, through this process, you have a lot more people that have been getting mental health counseling. If someone is getting mental health counseling currently, will they just still be dropped if they can't afford to roll over into another plan? Will that leave people getting mental health coverage? They get dropped, let's say, if they aren't able to afford a new plan. Is that going to be taken into consideration for people that are getting mental health right now?
Let's answer the first question first.
Okay.
Okay. Yeah. About where you get information.
Cover Virginia website
Okay.
has an eligibility calculator on there. It has some of the high-level criteria for eligibility. Once again, we never want to rule anyone out until we've had an opportunity to review their information, their income. As I stated, all income's not countable. it's not that cut and dry as to what eligibility is, but there is a calculator out there.
Specifically asking about like the details. So if the child is getting a food plan at college, like does that
Not countable.
Right, okay.
Not countable.
And a lot of college kids are on Medicaid.
Exactly.
A lot of med students are on Medicaid. Okay,
Yep.
particularly with the expansion because the income is higher and until age 26, so a lot of kids are on there. It's easier to see. The harder question you ask is about diagnoses, meaning is diagnosis considered an eligibility? And the answer is in part, that's why Janice is saying is that person then disabled? That's a different issue. So if they're disabled, then they would fall into the disabled category, and all that's calculated in the answer. And the other answer is if that you are not disabled, but you're earning income that's in excess. That's why we would say we would walk you through to get an exchange in the same plan that you were with, so that way you can continue to see your physicians and your providers. Okay, so that's the walkthrough. That was what Janice was saying that we did that most states didn't do, which was bring both the commercial side and the Medicaid side together to do that link.
So just to close this out, I just want to thank everyone. We had several community leaders here who are getting this information to pass along. And I just want to thank every one of you for being here and all of the residents. And I was just amazed with what you have accomplished. So thank you, Director Roberts, and all of your team. And we would not have had this event without Will Franks, who works with DMAS and worked with my team, my legislative assistant, Zachary Sykes, and my communications director, Andrea Bell. So thank you all. So we're going to close this, as the director asked, with, if you need help, 8335 call Virginia. Thank you very much.